Okay, so healthcare in Nicaragua, an imperfect system. So the community. So I did a healthcare internship in San Ramon, Nicaragua, Nicaragua. And the town is very small. It's mostly comprised of campos. A campo is a community in a mountain, and barrios. And a barrio is just a community outside of the town's area. So this is my family. Mama Blanca, my host mom, is in the pink shirt. And El Centro de Salud is the name of the clinic that I worked at. So the clinic to me is kind of like a small hospital because they have an ER and a labor and delivery ward. The clinic is funded by a governmental program called MINSA, and its primary patients are women and children. So the theme goal of the clinic is to administer health to all individuals in the San Ramon area, and they pay special attention to women and children. These are some of the doctors and nurses that I worked with while I was there. These are some of the signs that you will see throughout the entire clinic. So the clinic is very proud that their government provides funding for these free medical services. Okay, so what did I do? So I spent 90% of my time actually outside of the clinic in campos and barrios on vaccination campaigns. So vaccinating people for things for hepatitis B, H1N1, leptospirosis, which is a disease contracted by rat urine. So a lot of the houses have rats and mice, and the food gets contaminated with their urine, and so they get this disease. Also, inside of the clinic, my main job was working in the ER. So I basically would sit in the ER, monitor the ER, and when a patient would come in, I would go run and try and find some kind of medical assistance. And my independent project that I kind of did when I was there were interviews. So I interviewed some of the female patients there just to get a sense of their health concerns and the services provided by the clinic, and also the quality of those services. I also spent a considerable amount of time at La Casa Materna, which is a clinic in San Ramon where women from the campos come to during their 9th month of pregnancy. I taught a self-esteem class here entitled 8 Steps to a Better You. It's in Spanish, it's kind of hard to see. So those were just some of the things that I did while I was outside and inside of the clinic. So challenges. I faced a lot of personal and work challenges. Some of my personal challenges were the language barrier. So I went to Nicaragua with like little Spanish language background, which probably wasn't the wisest idea. So I had a lot of trouble with the language, but I learned it very quickly. The touching, fascination, and lack of personal space. So in San Ramon, there are no black people there. And so they were constantly touching my hair, my skin, telling me how curious I was and how beautiful I was. And I mean, I'm just not used to that kind of attention in the US, so that was very challenging for me. So my work challenges. I faced a number of work challenges. The main one was sanitation, or the lack of. So the best example that I have of this is my second day of work. I was poked in the thigh with a contaminated needle. And the way that happened is because instead of using biohazard containers like the US does, they simply dispose of their contaminated needles either in a plastic bag or wherever. And so the nurse had me hold one of these bags, and I was poked in the needle when she gave it to me. And so I had to take an HIV test, a hepatitis B and C test while I was there. And then I had to come back to the US 6 months later and take another HIV test. So I can imagine that you all realize why that would have been very challenging, very hard for me. The lack of supplies. So MINSA, the governmental program that provides their funding, they send them shipments of medical supplies every few months. And so they have to have those supplies last until their next shipment. So there's always a constant shortage of supplies. The lack of motivation concerns. So I feel like the best example of this is work efficiency. So we're supposed to be in this campo at 10 a.m. We get there at 2:30 p.m. and we're not even prepared. So we didn't bring alcohol gel or alcohol or cotton to give the vaccination shots. And so we simply give dry shots. The lack of privacy. So I feel like medical confidentiality is highly stressed and important in the US, And in this particular clinic, it just isn't. So you'll have 2 nurses and 2 doctors, well, 2 nurses and 2 patients in a room, and they each can hear each other's medical recommendations. So what did I conclude from this internship experience? Well, obviously the reality of the healthcare system. So I have spent a significant amount of time as a pre-med student in hospitals and clinics within the U.S., and then to have this knowledge of how our healthcare system works here, and to go to a different country with this knowledge, deemed poisonous knowledge for me. So I'm like, wait, stop, you're doing it all wrong. And my host mom would tell me, Tequilla, you know, you're an American, you're here, you're visiting, you're gonna go back to the US and things are gonna be fine. This is my life. So my host mom, she didn't go to the clinic because of the lack of medical assistance and the lack of resources there. And she would talk about how children in the campos were dying from mountain leprosy because of the lack of care. So that was that was a very significant conclusion that I walked away with. Also, poverty. So Nicaragua is the poorest country in Central America. It's the 2nd poorest country in Latin America. And I feel like when I got there, my idea of poverty was very romanticized. And so sometimes I would have to step back and say, you know, Tequilla, your petty frustrations with the lack of resources and the things that are going on don't even pale in comparison to the overarching problem of poverty, which is why they don't have these resources and they don't have the proper medical assistance. On helplessness. So at the end of my internship, I felt an overall sense of helplessness. I feel like I didn't actually do anything. So my last day of work, before I even got to the exit gate, I was in tears because I felt like I was turning my back on an obvious need, that when I leave, the same issues that are going on right now are probably likely to occur. And so it was very hard for me to come to that realization and experience that kind of reality. And I would like to acknowledge the following. And thank you for your time and attention.